Hi, welcome to our presentation. Today we're going to be talking about smoking and vaping in young adults. My name is Daniela.
Hi, my name is Tiffany.
And my name's Katie. So the purpose of our project is to share the health effects of smoking and vaping in the younger population due to its increasing prevalence. People start smoking or vaping for many reasons. Many teens start because they think it's cool, others do it to rebel against their parents. Some may feel pressured from their peers while others grew up with it in their household. It can be associated with normalcy and the only way to relieve any form of pent-up stress. So what happens after nicotine is inhaled? First of all, what is nicotine and why do people like it? So nicotine mirrors the effects of amphetamines, which is kind of like speed or cocaine. It has the ability to increase a person's attention, focus, as well as their reaction time. So how does nicotine affect the body? Nicotine can be both inhaled or consumed. Today we're going to focus on inhalation. Whether vaping or smoking, the nicotine follows the same pathway through your lungs. When the smoke or vapor is inhaled, nicotine travels through the alveoli, crossing the capillary beds to the blood circulation. And once the nicotine reaches blood circulation, it is able to travel up towards the brain, crossing the blood-brain barrier. Upon inhalation, it takes about 6 to 10 seconds for the presentation of effects. So now I'm going to talk about smoking and vaping and the differences. First, smoking, there are over 7,000 different kinds of chemicals that are inhaled from the cigarette smoke, and among these, there's a staggering 250 that are known to be damaging carcinogens. 70 of these chemicals have been linked to cancer. Some chemicals that are found in the smoke include ammonia, benzene, formaldehyde, lead, and hydrogen cyanide. In regards to vaping, unlike smoking, there is no combustion when in the vapor. Because of this, some may argue that vaping is a safer option. Due to the mechanism of vaporizing, there is no introduction of any new chemicals or substances. The main components of vaping liquid is vegetable glycerin, propylene glycol, and a higher dose of nicotine. While there is less chemicals in vaping, the ingredients are just as harmful. For instance, there's acetaldehyde, benzene, nitrosamines, and formaldehyde. Other chemicals can come from the flavoring. Studies have shown that the airborne chemicals released from the exhaled vapor contain volatile organic compounds, and these chemicals are harmful when inhaled and have been found to have no scent.
Now we're going to talk about some statistics and information about e-cigarettes or vaping. So EVALI is a term used to represent e-cigarette or vaping injuries or deaths. And so as of January in 2021, there's an estimated 3.58 million youth that are currently using e-cigarettes, with 60 confirmed deaths from vaping. From this, there's about 15% that are under 18 years old that vape. There's about 37% that are 18 to 24-year-olds. And there was a reported 57% that were using nicotine-containing products. And furthermore, there was 14% that reported the exclusive use of nicotine-containing products. For cigarettes, cigarette smoking causes about 480,000 deaths per year, and more than 16 million Americans live with a disease that's caused by smoking. For every person who dies because of smoking, 30 people live with a serious disease from smoking. And there's about 14% of adults that are 18 years or older who are current cigarette smokers back in 2019. In that year, there was also about 41,000 deaths per year from secondhand smoke, as well as 13,000 people that die from secondhand smoke every day. And last, there's about 99% people who first smoke cigarettes by the age of 26. So in this slide, you can see there are many different terms associated with cigarettes and many different terms associated with vapes. And these are the most common brands that you would find. And what's important to know from here is that electronic cigarettes do not have an FDA approval to be a smoking cessation aid. Okay, so did you know young people who use e-cigarettes are 4 times more likely to start smoking cigarettes? 6 out of 10 high school age cigarette smokers have used e-cigarettes. And 9 out of 10 adults who smoke cigarettes daily first tried smoking by the age of 18. If cigarette smoking continues at the current rate, 5.6 million of today's youth will die early from a smoking-related illness. Only 37% of current Juul users, which is a vaping brand, knew that there was nicotine in the product. So most of these users did not know that their product they were vaping had nicotine. 43% of students began using e-cigarettes because of appealing flavors, such as cotton candy, grape, bubblegum. And youth who use multiple tobacco products are at a higher risk to develop nicotine dependence. So the majority of teenagers who use e-cigarettes think that they're only vaping flavoring and not nicotine. But 99% of e-cigarettes that are sold in the US contain nicotine. And the advertising, plus these appealing flavors, is a target to youth e-cigarette use. So what are the costs of e-cigarettes and cigarettes? E-cigarettes, the Juul starter kit starts at about $50, and $16 for 4 pods, and daily teen users reported spending about $25 a week on these pods. So for the whole year, it's about $1,350. And if you do this habit for over 10 years, it'll be $13,000. For cigarettes, the average cost of a pack is $6.28. And a pack-a-day habit costs about $188 a month. And for the whole year, that's $2,000. And 10 years of smoking brings you to $22,000. So adding all this money up would be the same amount of money that you spent on a vacation, on a car, or maybe for your college fund. And especially super important to note, the cost of medical consequences are thousands and thousands of dollars. So let's talk about some myths. The first myth is that e-cigarettes are safer than regular cigarettes because they do not contain harmful chemicals. And this is false, because although the aerosol that's found in the e-cigarettes has fewer toxic chemicals than normal cigarettes, it doesn't mean that they don't contain any harmful chemicals. Along with nicotine, there are heavy metals such as tin and lead and other cancer-causing agents. The second myth, e-cigarettes are not addictive. This is false. Nicotine is the primary chemical that's found in both cigarettes and e-cigarettes, and this is a drug that holds significant addiction potential. The third myth is that e-cigarettes are the best option for people who want to quit smoking cigarettes. This is false. They are not the best option. There are several FDA-approved meds that are more effective, and as well, there are nicotine patches or nicotine gum that are also a better option. And finally, the myth is that filters make cigarettes safer. This is false. Filters do not protect you. They're designed to make smoke particles smaller so nicotine is easier to absorb, and this increases the addiction potential.
So there are many similarities between smoking and vaping, such as nicotine overdose. Especially in vaping products, some contain higher nicotine levels than others, as well as the label not indicating the true nicotine content. This results in high amount of nicotine per puff, and there are also vaping packages that claim to be nicotine-free, but have later been found to actually contain nicotine. Nicotine can also cause fatigue and low energy to occur and results in adolescents to feel the need to smoke more in order to feel more awake. There's also the e-liquid components that make up the flavoring agents, which can also serve as a primary irritant for the respiratory system, which can cause throat and mouth irritation and lung inflammation. Adolescents also have a chance, and as well as young adults, of getting poisoned as a result of vaping, especially. And children and adults have been poisoned by swallowing or breathing or absorbing the e-cigarette liquid through their skin or eyes. Burns for both smoking and vaping can also result of it, especially with e-cigarettes. It can be a result of overheating, and this can cause burning to the skin. There's also another short-term condition known as EVALI, also known as e-cigarette or vaping product use associated lung injury. And this is a short-term health effect that can affect cigarette and vaping users. It's been especially more prominent in the vaping community, which can cause shortness of breath, coughing, chest pain, diarrhea, nausea, and vomiting, rapid heart rate, and rapid and shallow breathing. And however, these short-term health effects can also pursue to long-term health effects. So like I had mentioned, if you continue to smoke or vape, a lot of these symptoms that you experience as short-term health effects can pursue to become long-term health effects. And these can include the increase in heart rate and blood pressure, and this can also cause an increase for the risk of hypertension and heart disease and your ability to fight off the infection. There's also a condition called popcorn lung disease that occurs in both smoking and vaping, but it has been definitely shown to be more prominent within vaping community. So what popcorn lung disease is essentially a lung disease that causes a scarring of the tiny air sacs in the lungs, and this results in thickening and narrowing of the airways. These symptoms you can experience from popcorn lung are coughing, wheezing, shortness of breath, which are similarly to the symptoms of chronic obstructive pulmonary disease. This is present in both vaping and cigarette users, like I had mentioned. And the chemical that's in the, especially in the vaping product, is called diacetyl, which is a buttery flavored chemical that is used in popcorn products. Although it is tasty, it has been linked to deaths in many cases of popcorn lung. And although many of the popcorn manufacturers have not removed diacetyl from their products, you can also get exposed to this chemical through e-cigarette vapor and has been found in many of the e-liquid flavors. And long-term smoking can also cause inflammation, both swelling and sensitivity of the lungs, and this can also result in irreversible lung scarring over time. And smoking and vaping has also caused many skin issues. This can include the breakdown of the collagen and elastin on the face, which can cause premature wrinkling and aging. This can also increase the risk for skin cancer and slow the ability to heal wounds and increase the risk of skin cancer. So for vaping users especially, there is a high risk to contract nickel allergy. Some vaping products also contain a nickel material in their jewel pods, and the exposure of nickel can cause an itchy rash to appear on your skin when you're exposed to that metal. Long-term smoking can also cause the development of asthma symptoms. So for those that have already been diagnosed with asthma, smoking can cause asthma flare-ups to occur more frequently. And there are also other conditions that you can also experience with smoking and vaping. And this, like I had previously mentioned, they can get chronic obstructive pulmonary disease, acute respiratory distress syndrome, along with lung cancer later down in adulthood if they continue to smoke or vape. So dental and oral health is also an essential part of your overall health and well-being. And poor oral health can cause the following symptoms of yeast infection of the mouth and throat, bad breath, discoloration of the tongue and teeth. If you're a vaping user or vape users, you can cause the loss of teeth if it's a defective product that results in the overheating of the product. There's also dryness of mouth and sensitivity, and inflammation of the gums. So, poor oral health can cause an increase for the development of periodontal disease or oral cancer as well. And for smoking and vaping, this can, although you, excuse me, for smoking and vaping users, this not only affects short-term and long-term health effects, but it can also affect your peers, your family members, and friends through secondhand smoking. Secondhand smoking can cause indoor air quality to become lowered and expose them to ingestion, inhalation, and touch when they come in contact with cigarettes or vaping. The exposure of secondhand smoking can cause their immune system to be weakened or become more prone to air and respiratory infections, as well as asthma flare-ups, and cause adolescents or young adults to miss more days of school. Smoking and vaping can also affect adolescents' brain development, which can affect their memory, concentration, learning, and self-control. For adolescents, their brain continues to grow until age 25. However, smoking or vaping can also cause them to lower productivity and accuracy in their studies. So, as I mentioned before, long-term, many of the short-term can affect their long-term symptoms, and this can also result in mood disorders and permanently lowering their impulse control and sensitizing the brain for future substance use. And adolescents with ADHD, for example, are more likely to take risk-taking choices and experiment with other substance abuse. This can also result in forming bad habits early on and creating physical dependence for nicotine. Adolescent tobacco use can also associate with later risk of developing mental and behavioral problems, and this can also include depressive disorders or academic problems, or it can also worsen anxiety and their irritability. The use of nicotine can also especially affect the sleep deficiency, and this is because nicotine is also a stimulant. It increases the alertness, so if you smoke too close to bedtime, it can affect your ability to go to sleep. Over time, this can also increase the risk for insomnia in adulthood. Smoking can also decrease the overall fitness in their sports teams or affecting their performance due to many of the respiratory conditions that I have explained previously involved with smoking.
Now we're going to talk about some substance use disorder, and this is mainly coming from nicotine, since that is the most addictive chemical that is in both cigarettes and in the vaping liquid. And did you know that one Juul pod for vaping contains the amount of nicotine that's equal to about 20 regular cigarettes? So what is addiction? Addiction is the psychological and compulsive need for a habit-forming drug, such as nicotine, despite negative consequences. Dependence is a physical need for the body to receive the drug, and this is characterized by tolerance and withdrawal. But there is also such a thing as mental dependence, and this is when the use of a substance is a conditioned and emotional response to an event or feeling, and this is known as a trigger. So the treatment of adolescent smoking and vaping is a substantial public health priority. And this is because partly that nicotine exposure during adolescence can cause harm and addiction in the developing brain, and this can turn into nicotine use in adulthood. Adolescents that have substance use disorders are also at a particularly high risk for becoming tobacco dependent and are less likely to quit than other youth. And finally, e-cigarettes can also have THC in them from marijuana, and this is the hallucinogenic property in marijuana. In 2016, a third of the US middle school and high school students who had used e-cigarettes had used marijuana in the e-cigarettes. So after nicotine addiction or dependence, what is withdrawal? Withdrawal is caused when a substance that had caused physical dependence is abruptly stopped. And some of the symptoms from nicotine withdrawal are having difficulty concentrating, difficulty sleeping, having depression and anxiety, having an increased appetite, having frustration and anger, and as well as nicotine cravings. So did you know that in 2018, about half the population of adult cigarette smokers had made an attempt to quit smoking in the past year? Furthermore, in 2019, also about half the population of middle school and high school students who had used e-cigarettes also attempted to quit vaping in the past year.
So there are some healthy alternatives to smoking. And so what could you do instead, and how do you avoid the temptation? So one of the main reasons people have such a hard time quitting is not only because of the addiction, but also because it's ingrained into their routine. Taking a smoke break has been ingrained into your everyday life, making it a habit. The best thing to do is try and change up your routine while avoiding any triggers that might drive this temptation. Studies have shown that introducing relaxation techniques has been very beneficial. Oftentimes, people increase their smoking intake when they are in high-stress situations, and it can feel like the nicotine is their only way to achieve this state of serenity. If a person is able to introduce a new way to de-stress and relax into their routine, the trigger to smoke will become less prominent. Physical activity has also been shown to distract the mind. Now onto pharmacological cessation. First off, I will disclose that none of these forms of cessation are FDA approved for vaping cessation entirely or in tobacco users under the age of 18. Through nicotine replacement therapy, you are able to deliver nicotine more safely to your body. The different dosage forms include gum, a lozenge, a patch, mouth sprays, or an inhaler. This form of therapy helps to decrease a person's craving and relieve some of the unpleasant symptoms assimilated with withdrawal. All these forms of therapy are available without a prescription, however, they should be discussed with your doctor. And nicotine patches are the most common form used today. There's also prescriptions that you can get from your doctor, such as bupropion and varenicline. And unfortunately, there is no cure for nicotine addiction. It will take a lot of determination and hard work, and it will only work for a person who really wants to quit. Next, on to non-pharmacological cessation. Interventions have been found to be very effective when talking to someone about their nicotine addiction. Patient education is a vital part of recovery. Oftentimes, people with an addiction don't know the extent of harm that they're causing to their body. Talking about the dangerous long-term and short-term effects can help open the door to recovery. There are also many resources available to people suffering from addiction. There are centers, focus groups, and resources online that provide support. Studies have shown that even just having one counseling session, which can last about 10 minutes, has shown increasingly good signs of improvement. However, it is found that group counseling is the most effective method. It helps people to speak about their addiction with people who are going through the same thing as them. It helps them to realize that they're not so alone. So where can you go to get help? Here's some resources that we have compiled for you or someone you may know who is suffering from addiction. These resources range from Connecticut, Massachusetts, to online virtual help, and they can even link you to phone numbers where you can call someone. I hope you guys enjoyed our presentation today and you guys learned a lot. Thank you.